Okay. So I want to thank you all for coming today. I'm going to make a start as we appreciate that this is an evening webinar and we know your time is precious, whether you're in work or not. We know how busy everyone is at the moment. So please note we are recording the webinar and a copy will be shared alongside the slides on our hub pages. Due to the numbers on the call, cameras and microphones have been disabled, and we have scheduled this for 1 hour. We will be sharing some polls, undertaking short survey questions and evaluations. So for some of these, there will be a link or a QR code, and others will be embedded into the chat function in Teams. So have your cameras ready if you want to use the QR codes that will come up on screen as part of the presentation. I would like to say that you can also use the chat function to make comments and ask questions, and we will have colleagues monitoring the chat, and we will check these at the end of the session to make sure that we've covered everything. So if we do run out of time, we also want to assure you that we will pick up any unresolved questions after the webinar, and we will contact you directly to answer these. So if you'd like any further support, please use the Safe Staffing email. We will have this at the end of the webinar, and we will respond to your request. And at this point, I do also like to just point out that if you are having any difficulty seeing or hearing the presentation or accessing the polls, unfortunately, this is outside our control. We do advise you try going out and coming back in, but that is why we're recording this today. So if you do experience any technical difficulties, you will still be able to watch the recording and see the slides presented on our hub page when they're uploaded. So to start our overview of the work of the Safe Staffing team, 24 to 25, we wanted to start by introducing the team, and I've got many of my colleagues with me on the call today. So my name is Melissa Cook, and I'm one of the Safe Staffing advisors, and I will be taking you through the first half of the presentation, and our program lead, Stephanie Tom, will be taking you through the last part. Candice and Ashley are supporting and will be entering links into the chat function, as well as monitoring the chat and questions. We also work alongside our colleague Glo McLaughlin, who isn't joining us for this webinar, and Marie McCary, our chief nurse, oversees the programme. So here is an overview of the areas that we will be recovering today. So we're going to be looking at our objectives. We're going to be taking a very brief look at the Act itself, and we're going to also show you some of the resources that we have available. We're going to look at local and integrated authorities reporting, inspection and self-evaluation, and at the end we will try and come to questions, and we do have a QR code for an evaluation as well. So before we go any further, in our team, we feel it's really important to address the realities facing the social care sector. So that's whether you're working in adults, children and young people, or early learning and childcare. We are all aware and are all likely to have experienced one or more of the pressures that you can see listed on the screen. So these include fuel inflation, the cost of living, staff wages, local authorities' budgets, the wider economic and financial context, UK immigration policy, recruitment and retention, an ageing population, and increased competition for working age people. So this isn't an inclusive list by any means, and I'm sure we could all spend the hour discussing the challenges services are facing. And we want you to know the Care Inspectorate is very aware of how tough recruitment and retention continues to be for many services. And we are aware that staff morale can suffer because of one or more of the challenges listed here. We also want to say that we do continue to get questions about funding from services. And while we always state that unfortunately the Care Inspectorate has no authority over funding, and it's not something we can advise on in our team, we fully understand that this is a real pressure for many services. And as it is a key theme that comes out of the many presentations, events and webinars that we have held, this is being fed back to the Scottish Government. So before I go any further, this is the first one of our polls. And it's just one question. You do have an opportunity to leave your contact details if you would like more information. But the question being, has the implementation of the Health and Care Staffing Scotland Act 2019 impacted on your staffing practice? And there are 7 different answers to choose from. I'm just going to give everyone a minute just to answer that. And just to let you know, it is anonymous. This is really information for our benefit within the Safe Staffing programme, and it just supports the development of events and webinars such as this, and it just helps us to know that we're reaching the right audience with the right message. So I'm going to move on now to give you a brief overview of our objectives. So last year saw the Safe Staffing programme focus on sharing information on the Health and Care Staffing Scotland Act 2019 across all services and organisations. We held close to 500 different events in a range of ways, from online to in person, and over 7,500 people attended these. So full details of the achievements of the Safe Staffing programme from last year can now be read in our end of year report. So while last year we focused on pre-enactment, our objectives set by the Scottish Government this year have changed. On screen, you will see the objectives for the Safe Staffing programme for the next year. So these are to ensure governance arrangements and reporting are in place, to continue to increase stakeholder engagement, review and update existing supporting guidance, and explore how compliance with the Health and Care Staffing Scotland Act can be reported. So you can see that there is still an emphasis on supporting the sector through the first year of enactment, and that is really important to us in the Safe Staffing team. So I'm going to move into the Act now, and there are 4 parts to the Act that you can see on the screen. So it's Part 1, the guiding principles, and Part 3, staffing in care services that are most relevant to social care. Chapter 3A is for care homes for adults only at this stage, but it is something that I am going to touch on in a few slides' time. So just to make you aware, Part 2 is only for the NHS, and Part 4 is where we find general provisions which give powers to the Scottish ministers around enactment of the legislation and to make amendments as necessary. All care services have a duty to follow Part 1, the guiding principles, and Part 3. And Part 3 includes Section 7, appropriate staffing, and Section 8, staff training and qualifications. Before we get into Part 1 of the Act, we feel it is important to cover who the Act applies to, and this is both in terms of services and staff. So on this slide, we address who the Act applies to in terms of services. So a care service is defined in the Health and Care Staffing Scotland Act 2019 as a service mentioned in Section 47 of the Public Services Reform Scotland Act of 2010. And what you can see on screen are the full list of services the 2010 Act covers. And this includes early learning and childcare, adult services, as well as children and young people. So basically, it's any service registered with the Care Inspectorate who our inspectors inspect. So if your service is registered with the Care Inspectorate, then the Act applies to your service. In terms of staff, the Act applies to. The Act defines workers in a care service in Section 11. So this includes working for payment or as a volunteer, working under a contract of service or apprenticeship, a contract for services, or otherwise than under a contract. So this would include, for example, employees of the care service, agency and other temporary and contract workers, self-employed workers, those on apprenticeship schemes and other earn-as-you-learn schemes, and all volunteers. And I like to point out that there's lots of useful information about supporting volunteers on the Volunteer Scotland website. So moving into Part 1 of the Act. Part 1 tells us the guiding principles for health and care staffing, and these apply to all social care services. Part 1A of the Act states that the main purposes of staffing health care and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use services. So the rest of the Act is about making these main purposes happen. And what we want to see moving forward is that services should be able to demonstrate in their own way how they have considered the Act, including the guiding principles, and use them when making decisions about their service. So with Part 1A setting out the overall guiding principles, Part 1B goes further and sets out 8 principles that you can see on the screen. So the Act states that these 8 principles must be considered when arranging staffing in any service type, and that's in order to achieve the overall principles of the Act that we just reviewed in the last slide. So these are likely to already be familiar to you in one form or another. However, we do like to direct your attention to Guiding Principle 5, as this is the first time the well-being of staff has been included in legislation like this. However, this is insofar as it affects the outcomes for people. Over the last year, during some events, we took a deeper dive into these 8 guiding principles with services and across sectors, and to share good practice that identified how services were already meeting every one of the 8 guiding principles. So we took all this information away and collated it into word clouds for each guiding principle, and you can access these on our hub pages. And I will be sharing some examples from these across the sectors in a few slides. So we've spoken about the connection between staffing and people's outcomes and the genuinely new principle in the law about ensuring the well-being of staff. The statutory guidance that accompanies the Act states that it's important to note that while the guiding principles are focused on outcomes for service users and the reference to safe is drafted with service users in mind, this cannot be separated from the well-being of staff themselves. So the statutory guidance also states when judging whether a service is safe, it does not mean no risk, and depending on the service, it may not even mean low risk. Risks are an inevitable part of healthcare services. In many services, a level of risk is required and needs to be managed by both service users and staff to support people to achieve outcomes. Positive risks, as defined in the health and social care standards, mean making balanced decisions about risks and benefits, recognizing that risks to safety are inevitable and can sometimes result in benefits. So let's consider what happens when staff well-being is not being taken care of. So staff may be more prone to stress, fatigue, and burnout. Staff who are unwell will struggle to concentrate or work effectively, reducing the quality of their work. Poor staff well-being can increase absence rates due to physical or mental health issues. And when staff well-being is not prioritised, staff may feel less satisfied, so they might stop trying and they might leave the service altogether. And importantly, any of this may have negative consequences on care outcomes for people. So, however, improvements in staff well-being will lead to increased productivity, improved performance, sustained workforce, better attendance, improved satisfaction, and an increase in morale. And we always say that we can all agree that enthusiasm spreads. So this is more likely to bring about much better outcomes for those that we are trying to support in social care. So the next few slides are examples of the word clouds we put together from the events we completed last year. So this is where the sector told us how they were already meeting these guiding principles, and this is an example of Guiding Principle 5, ensuring the well-being of staff. And we really like to share these examples because it really does show how services are already doing this, but we really like to share the well-being of staff because it's not necessarily about lavish outings and spending a lot of money to support the well-being of staff. As you can see here, quite clearly, the well-being of staff that services across sectors are saying is that supervision and meetings are one of the best ways that you can do that. And there are lots of ways that you can look at the well-being of your staff and support them. But I think it's really interesting that actually one of the really basic and fundamental things that services are looking at to do that is supervision and meetings. So here is guiding principle 7, allocating staff efficiently and effectively. And I do like to point out that this hasn't come from one particular sector. This is all the sectors: adults, children and young people, and early learning and childcare. And finally, the last example I'm just going to show with you is guiding principle 8, and that's promoting multidisciplinary services as appropriate. And again, just to reiterate that all of these are on our hub pages. If you did want to have a look at them and perhaps use the idea to create some ideas in your own services, that's something that you can definitely take forward. So that was part 1 of the Act. Part 3 of the Act places a duty on care service providers to ensure appropriate staffing and covers the training of staff. So this was previously covered by Regulation 15 of the Scottish Statutory Instruments. Regulation 15, as of the 1st of April this year, was repealed, and inspectors are now evaluating staffing against Part 3, Section 7 in terms of appropriate staffing, and Part 3, Section 8 in terms of the training of staff. So just to make you aware, it's only Section 7 and Section 8 of the Health and Care Staffing Scotland Act that are enforceable. So Part 3, Section 1 states that there is a duty on providers to ensure appropriate staffing. And that's through looking at the health and well-being of people, provision of safe and high quality care, and insofar as it affects either of those matters, the well-being of staff. So the legislation does not impose specific staffing levels. So when determining what constitutes appropriate staffing levels, you should consider that you're the expert in this. You will know your service much better than we will be able to tell you. So just as we explained with the guiding principles that it's about how you meet those in your own way, this is no different. We do also like to point out that for ELC services, any ratios of staff to children given to your service at the time of registration or updated registration will still apply. So the Act does not change any ratio numbers. So Part 3, Section 2 places a duty on providers to always determine appropriate staff numbers at all times, and that's with regards to the nature of the care service, the size of the care service, the aims and the objectives, the number of people who use the service, and the needs of those people. So what is meant by appropriate staffing at all times? So care can often be delivered over for what we refer to as a 24/7 basis. So that might be some kind of residential type home. So that could be taken as it's having its normal everyday meaning in relation to the aims and objectives of each individual care service. But there might be services out there that, for example, an after school service, you might only be operating for several hours in an evening, and the staff that you would have during that time is how you would say is how you would look at providing appropriate staffing at that time. So again, it's very much dependent on your individual care service and how you organise that. So Part 3, Section 8 of the Act states that any person who provides a care service must ensure that individuals working in that care service receive appropriate training for the work they are to perform and suitable assistance, including time off work, to obtain further qualifications. And we do like to add that this part of the Act has its wording taken directly from Regulation 15. So there has been some confusion that this is a new ask. It's come up quite recently for us, in several different events that we've held. So we do want to say that whatever you were doing prior to the Health and Care Staffing Scotland Act under Regulation 15, this would be no different. So this slide focuses on the promise. So the independent care review was commissioned back in 2016, and through this, the review identified 5 key foundations that underpin the promise. And together, they give Scotland a clear starting point when thinking about what matters and to keep the promise. So this image shows the 5 foundations the promise is based on. Voice is the first, and in keeping this area of the promise, this states that children and young people must be listened to. This is involving them meaningfully and appropriately when decisions are being made about their care. So it's not just about listening to voices, but responding appropriately as well. And almost every one of the 8 guiding principles can be seen in this area, especially number 3, respecting the dignity and rights of service users, and number 4, taking account of the views of staff and service users. The second foundation of the promise is family. The promise states that where children are safe in their families and feel loved, they must remain with their families. The promise also identifies that families should receive support to overcome difficulties. Again, many of the 8 guiding principles apply here, but in particular the first, improving standards and outcomes for service users. The third foundation is care, and the promise focuses on keeping siblings together when they can't live with their family. And that's as long as it's safe, and it states all children must belong to a loving home and stay there for as long as they need to. Again, we could look at guiding principle 1 or 3 to support this foundation. However, we question if guiding principle 7, which is allocating staff efficiently and effectively, could come into play here. The fourth foundation is people, and it states the children Scotland cares for must be supported to develop relationships, and that's with both the staff they're working with as well as the wider community. It states that we must be supported to listen, to be compassionate in our care and our decision making. So think about guiding principle 6 here, being open with staff and service users about decisions on staffing. But it's not just the guiding principles that applies to the promise in terms of the Health and Care Staffing Scotland Act 2019. We've just briefly touched on the training the new Act covers, and training is vital for those caring for children and young people to be supported. Finally, the 5th foundation is scaffolding. It's the black outline of the heart that you can see on the screen, and it brings together all of the foundations and it keeps them together. And the promise states that children, families, and the workforce are supported by a system that is there when it is needed. And we would argue that the whole Health and Care Staffing Scotland Act supports the scaffolding of the promise. So while the promise focuses very much on children and young people services, it spans early learning and childcare as well as adult services at times. And what we all need to keep in mind, therefore, is that the promise is inherently interlinked with the Act and with wanting better outcomes for children and young people and their families who experience care. So before we move on from the Act, you can see on screen the staffing method framework. And this is something you can access if you log onto our website or the Safe Staffing Hub page. And I will point out straight away, like I did at the beginning, this is not planned to be used in every registered service type. At present, this is only applicable to adult care home services. However, there is a caveat in the legislation that Scottish ministers may introduce this into other sectors in the future. And this is why we still include it in our presentations and webinars. The Scottish Government asked the Care Inspectorate to design a staffing method framework, firstly for adult care homes. So this has been created in response to Section 3A of the Act. And it was designed through 23-24 in consultation with adult care home services and stakeholders. So this considers key elements around staffing that supplements the dependency tool if used when determining staffing levels. So it's important that providers and services don't panic if they see this being discussed in relation to the new legislation and thinks this might relate to their service. Again, just to reiterate, this is just for adult care homes at this time. But it does set out a framework or process to be followed by a care service provider to determine what appropriate staffing is in any particular care service and setting. And I do know that through conversations, although again, this is just for adult care home services, I know that there are other services across sectors that are also looking at this just for some guidance. And that doesn't mean that that's something that we're looking for at the Care Inspectorate. If you feel this is something that you could take away and use in your service, then by all means, you can do that. So just to kind of cover what we've just looked at there. So we've looked at part one, the guiding principles, part three, section 7 in terms of staffing, part three, section 8 in terms of training, and part 3A in relation to the staffing method framework. And it's part three, section 7 and section 8 that are enforceable. So the next few slides will discuss some of the learning resources that are available to support services and individuals in their understanding of the Act. So you're likely going to be familiar with the learning resource on TURAS, the Knowledge and Skills Framework for Health and Care Staffing in Scotland. So level 1, Informed, is suitable for all staff and is 4 short videos that provide a foundation level of knowledge of the legislative requirements and workload and workforce planning. Level 2 is Skilled, and this is aimed at team leaders. And it's a suite of 4 modules providing a more in-depth look at the legislative requirements and offers a clearer understanding of workload and workforce planning methodology. So we are aware through feedback confirmed that these can come across as very clinical. They can be difficult to navigate. And we are aware that you do have to go through the NHS sections before you get to the social care sections. So the enhanced level is aimed at managers, and this is now available. And work is continuing by HIS to improve the resources with input from the sector. And just to let you know that the expert level is not yet released. So a learning and education resource that has been developed in collaboration with the ACT implementation team at the Scottish Government, NHS Education Scotland, HIS and the Care Inspectorate. And this is a SWAY that provides accessible resource and enables users to learn about the guiding principles and the different duties within the Act. So you can look at this in a formal learning, through formal learning and through additional learning and looking at relevant modules. And I do believe that one of my colleagues is likely to have put a link to that in the chat function. We also like to mention that Staffing Method Framework is now available as a web and mobile phone application. This is on the HIS Right Decision Service platform, and the link is in the chat again to this if this is something that you're interested in accessing. And there are also other 200 learning resources on this platform that you will see if this was something that you would like to know more about and you might benefit from in your service. So there are lots of resources to support the care sector, and this is through the Care Inspectorate hub pages. So you can see here that there are some posters that we've developed, and you can access these and print them off if you want to for your service. We don't have any that we have pre-printed and we send out, but these are a great resource if you wanted to share these with service users or families, and they're a great starting point for conversations. We do have quick guide cards that were given out at regional events to all participants, and we have now developed these into a SWAY. However, we do have some of these cards still available. So if you are wanting to receive some of these, please let us know. Drop us an email and we will make sure that we get some sent out to you. But there are Q&A sections there, there's information guides, there's quick guides. We have full webinars on there, and we also have quick guides and quick guide recordings as well. So there's lots of information for you to be able to use with your staff, for you to be able to use to get to understand the Act in whichever way you feel is most appropriate for yourselves. So before I hand you over to Steph to take you through the rest of the webinar presentation, we're going to pause here just to complete 2 short surveys that will be put into the chat function. So we hope that you have had a look at some of the information on the hub. So we're keen to hear which type of format of resource works well for you. It is anonymous, so please just take your time and let us know what works best for you. And there is an information free text box if you want to add any other ideas that you might have.
Thanks very much for that, Melissa. I'm actually going to take us forward in the next part of the presentation. I'll just give 1 more minute to fill in the responses. We've got a few responses coming in. We've got 4 currently for our first question, which is what safe staffing resource has been the most beneficial. If you could take a wee minute just to think about that and give us a wee answer, that would be fabulous. And if there is anything that you think that we don't have that you would like, we would really like to hear that as well. We're always wanting new ideas. So if you have any responses for the open text box, we would appreciate that as well. So moving forward, we are still working in information and resources. Half of the reason why we asked that question, because we want to support all of the social care sector moving forward. So we have started a HCSA implementation group. We are in the process of arranging to do some podcasts. These will not be visual, they will be sound only. We are looking at developing resources alongside the SSSC and HIS in terms of the knowledge and skills framework and taking that forward a little bit more in terms of social care. We have also put in the link for the web and mobile app, which you are more than welcome to use. It is a staffing method framework that is for care homes for adults in the first instance. However, we do believe that there is information within that framework that all service types could benefit from. So we would recommend that you have a little look at that. Just because it does say care homes for adults doesn't necessarily mean there wouldn't be information in there for all service types. And lastly, we are currently data mining to make sure that we have information to give to the Scottish Government for Ministers reporting in April 2025. So the HCSA is given local and integrated authorities reporting duties under the Act at the time of planning and securing care services. This applies to all services registered with the Care Inspectorate, planned and secured by a local or integrated authority. So for example, a HACP which has commissioned work from a provider to operate on their framework and provide care at home services. There are 2 reporting questions. And the first is, as you can see on the slide, please detail the steps you have taken as an organisation to comply with Section 3.2 of the Health and Care Staffing Scotland Act 2019. So they must have regard to the guiding principles. They must make sure that the service that's being commissioned has appropriate staffing. They must ensure that the service that's being commissioned has appropriate staff that are trained. They must have regard to the statutory guidance, and they must have regard to any other guidance that is issued by Scottish ministers. The second question is, please detail any ongoing risks that may affect your ability to comply with the duty set out in Section 3.2. This should detail any risks encountered when planning and securing care services that would affect HSCP's ability to comply with the requirements set out in question 1. So as you can see here, you can on the screen, when completing the questions on reporting, the local and integrated authorities must consider all services that fall within the above list that have been planned or secured within that current financial year, and there is no requirement to keep reporting on services once they have been planned or secured until such time as existing contracts, agreements or arrangements are renewed or renegotiated. Stakeholders recognise a need for a reduction in duplication with no additional pressure on services around reporting. The Act is not prescriptive on how information is gathered. Local and integrated authorities already gather some of this data through current quality assurance and process monitoring. They could consider looking at inspection and joint inspection reports. And over this inspection year, we are evaluating staffing using one of our quality indicators, and this will provide some useful intelligence. We also have the Care Inspectorate data store, which is a useful source of intelligence, as is the local and integrated authorities' previous commissioning experience with their wide range of local social care providers. So we wanted to discuss a little bit about inspection for 24-25. So here is what adult services will be inspected against. So you do have your key quality indicators and your key quality indicators, which are within the key quality questions. So you will be able to find these in your quality framework that is related to your service, and it will tell you whatever all of the quality indicators and the quality questions as well. So you can see here that there is a difference between better performing and poorer performing services in terms of inspection. That is not new. That has been around since the quality frameworks were introduced. The key questions in the quality indicators will vary by sector and service type, which is why we would advise you to access the quality framework related to your service type. And hopefully one of my colleagues will be putting that information into the chat for you. In terms of early learning and childcare for 24-25, you have the information here on the screen in terms of what would be inspected against, depending on, again, whether they are poorer performing or better performing. And lastly, here is what CYP, children and young people, would be inspected against for 24-25. I do want to make it clear, though, that in terms of quality frameworks, this is just a guide for inspections and not a hard and fast rule. We assess the core assurances at every inspection except during follow-up inspections. During inspection, if we have any concerns arising from the assessment of a particular core assurance, we must consider evaluating the relevant additional quality indicator or indicators. We use a proportionate approach to carry out the core assurance activities and use sampling to decide if any further scrutiny of these areas is required. We have updated our core assurances to include the numbers, skill mix and deployment of staff to make sure that we are monitoring the effective and good use of staff within those service types. But again, this would vary per service type and isn't a one-size-fits-all approach. We first began discussing self-evaluation test inspections with providers at the start of February 2024. Since then, Methodology have regularly shared information with the sector through provider updates and social media posts. This has been done to support services in preparing for self-evaluation and to ensure that tests were not a surprise. The Care Inspectorate and colleagues in Methodology have been working with adult care services to develop their skills around self-evaluation and support our upcoming test, where we will validate a service's self-evaluation during our inspections. This has included holding webinars which were attended by more than 800 people working in or providing adult care services. At these events, They were provided with practical support and advice to help services understand the process, as well as providing information on plans for the test inspections. Feedback from those who attended the webinars was very positive. We heard that the information provided was clear and easy to understand, and that people enjoyed the opportunity to hear real-life examples of how self-evaluation had led to improvements. Self-evaluation is where a service systematically examines itself, achievements and processes to assess whether it is meeting its stated objectives and outcomes efficiently and effectively. That is a quote from Audit Scotland. You don't have to have a separate improvement plan relating to the self-evaluation of core assurances. We know that the core assurances are a key driver to improve outcomes and minimise the risk of poor outcomes. This is why we examine these at every inspection. Core assurances are already part of every inspection, so you will be aware of these and know we will look for evidence relating to them. The core assurances are the fundamental basics of a service, so services should know where their strengths and areas for improvement lie in relation to them. This makes them a good starting point for providers to think about self-evaluations, and we want services and staff to be confident and honest when undertaking self-evaluation in their service. All adult services with an inspection scheduled between July and September of this year are involved in the test, and this is regardless of their SAT level, evaluations or service type. The aim of this test is to provide information on what stage services are at with self-evaluation, how well adult services self-evaluate, how easy it is for inspectors to effectively validate services self-evaluation. Self-evaluation is not something services should be doing solely for the benefit of the Care Inspectorate. It is a tool to help services identify and evaluate where they need to target their efforts to support improvement. A list of the core assurances previously shown on the earlier slide can be found at the front of the quality framework for the service type that you are within. There is more guidance and information for self-evaluation in our toolkits, which includes suggested questions to ask different groups and worked examples of self-evaluations. The toolkits also contain templates that services can use to support their self-evaluation and improvement plans. Hopefully my colleagues are putting those links for you in the chat. The testing is now well underway, and we hope that this will help the Care Inspectorate to establish a baseline and the next steps we will take to support services to adopt this approach and continue to build trusting relationships that support effective self-evaluation and proportionate inspection activity. We would encourage all services to complete core assurance self-evaluation and have a service improvement plan in place. We would anticipate providers to involve people who use the service, families, friends and carers of people who use your service, the staff who work in your service at all levels and in all roles, external professionals, other stakeholders, and providers can do this in whichever way works best for you and the people that you are supporting. And hopefully colleagues are placing links in the chat for the self-evaluation resources that we have available. We wanted to also remind services of the records that all services must keep guidance. There are some examples here of what is within these documents, and we want to make sure that you understand the need for these documents in terms of not only the records that you must keep, but in terms of the notifications that you must make to the Care Inspectorate as a legal requirement. Now, you may be aware that the Care Inspectorate, supported by this SSSC, are supporting adult care homes in Scotland by delivering a national quality improvement programme. The programme is for care home services with an inspection outcome evaluation of adequate. The first cohort took place from April to August of this year. From the 30 services invited to attend the programme, 28 have remained throughout the whole programme. This resulted in 28 improvement aims that directly related to the service's most recent inspection activity. Evaluations from Cohort 1 continue to be excellent, with positive feedback received from services. Some inspectors have recorded early improvements because of involvement in the programme. Planning for Cohort 2 has started, and it is anticipated this will support eligible adult care homes in the Tayside and Fife area. So that was a whistle-stop tour of the legislation, our team, and the direction we are taking over the next year to support services in Scotland. Here you can see our contact details on the slide, and we would be grateful if you could complete this final short evaluation form. And again, this is to provide us with information and feedback on how you have found the webinar, but also for us to use it to try and tailor webinars in the future or make things a little bit better depending on what you feel could be improved.